Hello, my name is Deanne McCarthy. I'm founder of Swiftsure Innovations. Our company mission is to develop products that prevent hospital-acquired infections. Mechanical ventilation provides life-saving treatments for critically ill patients. The downside of life support is the endotracheal tube that connects the mechanical ventilator to the patient's lungs provides a direct route for germs in the mouth, nose, and pharynx to enter the lungs, creating ventilator-acquired pneumonia, the most fatal and costly of hospital-acquired infections. Ventilator-acquired pneumonia affects upwards of 250,000 people in the United States annually at about a cost of around $40,000 a case, resulting in an additional $10 billion of healthcare spending. The progression of ventilator-acquired pneumonia is as such. The biofilm develops in the mouth, progresses to the endotracheal tube, and once a mature stage biofilm is developed, there's bacterial shedding. And once these are microaspirated into the lungs, ventilator-acquired pneumonia develops. This results in increased length of hospital stays, increased consumption of antibiotics, and it's also associated with the development of antibiotic-resistant bacteria. The current standard of oral care in ICU needs improvement. Currently, we focus on saliva management, so we are suctioning secretions and moisturizing with a water-based lubricant. We also do chemical control, so we paint the interior of the mouth with chlorhexidine, but it's difficult to clean the tube itself and to work around the tube and access all areas of the mouth. We also focus on mechanical removal through toothbrushing, but without the ability to rinse and irrigate these areas, it's very difficult and oral hygiene quickly deteriorates. Right now with COVID-19 patients, there's a huge focus on COVID-19 and coincidental bacterial infections. So the relationship between the oral microbiome and the severity of COVID infections is an active area of research. Right now, there are ongoing clinical trials studying the effects of nasal irrigation and gargling. And these government trials hypothesize that these activities will reduce viral load, viral shedding, risk of transmission, length of illness, and severity of illness. And currently, we're unable to provide nasal and oral irrigation for mechanically ventilated patients. And that's why we are developing the Complete Care endotracheal tube. It's important to note that this device has not yet received any approval from any regulatory agency at this stage. So the Complete Care endotracheal tube aims to isolate temporarily the nasal and oral cavities and create a closed system by the use of an accessory mouthpiece that aims to basically limit the production of aerosols and splash of bodily fluids, which will create a really safe work environment for frontline workers. It also aims to establish patient safety by limiting translocation of harmful bacteria in these regions to the subglottic region. And we think that this method will be easy, fast, and really efficient. So that means that the intervention can be carried out frequently, limiting the germs in these areas, and also moisturizing these mucous membranes, which are the body's first line of defense. Right now, we've received funding through the National Research Council, and we are developing CAD drawings through a researcher at Dalhousie University, and we are in discussions with the COA about funding of our first functional prototype through an engineering firm in Halifax. Shortly, we'll be raising $50,000 for developing some market research. We want to disseminate some technological discussion sheets to respiratory therapists and registered nurses across North America so we can compile some user inputs which will inform our design. And we are also looking to begin a design development plan. We aim to initiate our design development plan in January, hire a cross-functional team of subject matter experts, and a research and development team, as well as appoint a board of advisors. We've been patent pending with the USPTO since June of 2020. Our provisional patent application was put together by Douglas Portnow, a medtech-specific patent attorney in Silicon Valley, and we feel it's almost PCT ready. In terms of this device, there are two aspects to the device. One is the one-time use tube, and the second is the daily replaceable mouthpiece accessory. So based on these two revenue streams, we believe in an initial target market, we are looking at a revenue of $150 million annually with a chance to expand globally. And due to the unprecedented rates of mechanical ventilation, the global endotracheal tube market is expected to increase to $3.2 billion in 2026. We also feel that this product has the potential to have surgical applications, and it could be used for ENT surgeries that have the potential for uncontrolled bleeding. We're looking to partner with some good people who are enthusiastic about developing this product, and we feel it has the potential to benefit patients, frontline workers, and healthcare institutions overall.